Community oriented medical education and community based medical education. The objectives of lecture, we will see the terms and principles of both community oriented medical education and community based medical education. We will see the concept in both medical educations and approaches. Let us see the objective one by one. What is community? A group of individuals and families living together in a defined geographical area, usually village, town, or city, is termed as community. Example, if we will see the village of Shakra is one of the community, village of the Majma is one of the community, then Riyadh city is one of the community. So if we see the community, it's we can say uh, our village Shakra, then district Riyadh, country Saudi Arabia, and then globally. So we can say from local to global is an community. There is confusion in both terms of medical education, community oriented and community based. Let us see the exact difference. This is the exact difference between community oriented and community based medical education. When we see the term community oriented, it is the education that occurs about the community. And when we say the community based, it is the education or training that occurs in the community. So, about the community is oriented, and in the community is the community based medical education. This is the exact difference. In community oriented medical education, our philosophy is curriculum based. Our focus on what to teach based on community health needs, and this is the social accountability of each doctor. In contrast, the community based medical education is about teaching method, focus on where and how to teach, and it's an real world exposure in the community, which is important for the practical skill and empathy of physician. But remember, the shared goal of both types of medical education is we need to produce competent, compassionate, social accountable doctors. Definition. First, we will see community oriented. As we discussed, curriculum design around priority health needs of the community is occurs in the community oriented medical education. It links medical training with societal expectations, ensures future doctors are socially accountable. Example, if malaria is a major health issue, so our curriculum emphasizes prevention, diagnosis, and management of malaria. We have when well-known example of Saudi Arabia in during 2012, there is an endemic in Saudi Arabia. We can say it's in the MERS-CoV, Middle East Respiratory Syndrome coronavirus, and it's infected many camels, from camels to human, and this was the endemic in 2012. So, our curriculum of medical education should emphasize prevention, diagnosis, and management of MERS-CoV, Middle East Respiratory Syndrome. And in the example of pandemic, we know in 2019 there is coronavirus 2019, COVID. So, our medical education should have the strategy for prevention, diagnosis, and management of COVID 19. So, these are the examples of community oriented medical education. We need to see our people, our society health needs. In community based medical education, now as we seen, this is the medical education in the community. So, learning in community setting. Examples are villages, primary health centers, industries, and the schools. So our medical students should apply knowledge in real world environment, the which is a strength, the practical skill and communication skills of our medical students. In addition to this, we have field visit. In the field visit, student conduct a family survey in a village, understand housing, sanitation, nutrition, and health seeking behavior. Our Chakra University and our College of Medicine also did the last year some awareness campaigning about the breast cancer in the public place like the malls. So this is the example of community based medical education. What are the concept in community oriented? We should identify what should be taught based on community needs, and that encourages our primary focus should be on preventive care, promotive care, and curative care, not only curative care. The prevention and promotive are the most essential part of the community oriented medical education. Integration of basic science with clinical practice. During our first, second, and third year of study, we can say now due to preparatory years, we can say up to the fourth year, you need to study in the basic, and meanwhile, you will have the field visit and clinical practice about the community-based medical education. So it's an the integration. And our aim is that the concept of community oriented is that produces doctors who are relevant and responsible to the society. As we know that doctors should not only serve the hospital, they should serve the society. We will see in the next slides. What about concepts of the community-based medical education? It focuses on where and how students learn. That provides early clinical exposure outside hospital walls during your uh, basic sciences studies, that promotes understanding of social determinants of health, and in the medical students, it develops the empathy, teamwork, and leadership. During the community-based medical education, our students did many uh, research programs as well, including the study of myopathy in the school student, uh, including the knowledge, attitude, and knowledge of the epilepsy in local community of Chakra, then also awareness, knowledge, and the attitude towards the gastrointestinal reflux diseases. In addition to this, the chronic diseases, hypertension, diabetes mellitus screening program we did. These are all examples of community-based medical education. Now, approaches in community-oriented. The most important is problem-based learning. And these are the case studies from the community. And these case studies should be the common one. Curriculum design around local epidemiology. But don't forget, when we are covering the local epidemiology, the term community is from local to global. Early exposure to public health problem and integration of multiple disciplines, basic science, clinical science, and the social sciences. Approaches in the community-based medical education. We have field visit. We will start from the first year, second year, and third year. Uh, First year means excluding preparatory years. If we consider the preparatory years, so it is first, not first, second, third, and fourth year. Field visit in our villages, primary health centers, community health centers, industries, and the schools. Family studies about the health of our peoples, nutrition, and lifestyle assessment. Community surveys and health camps. As I mentioned before, the research studies we did, we also screened the vitamin B12 and the vitamin D deficiencies in our community. Hands-on learning, immunization drives, and health education sessions are the approaches for the community-based medical education. What are the key differences in both? What are the key differences in both medical education? Let us see. The focus of oriented is what should be taught in the curriculum, and in the best, where and how it is taught in the setting. Orientation, in community orientation, is social accountability, and in community based, the practical exposure. What is our priority? Strategy, emphasis is priority health needs in the community oriented and the real life skill and empathy in the community based. What are the settings for the community oriented? Classroom, hospital is the main setting, while in the community based, mainly community field work. So remember, for the community oriented, the setting is classroom and hospital, while in community based, mainly community. Yes, take away message. In community oriented medical education, orientation of curriculum, what should be your syllabus or curriculum, and in community based, teaching in the community. And both aim to produce competent, compassionate, and socially accountable doctors and Very important. Doctor should serve not only hospitals but also society. We will see the explanation of this term. Thank you very much. Let us see continue the one question about doctor should not serve only the hospitals but society. Just a minute. Doctors are expected to serve not only in hospitals but also in society. Discuss this statement with reference to their curative, preventive, and social roles in healthcare. Doctors plays a vital role in protecting and promoting health. Their duty is not limited to hospitals. They also serve the larger community. A balanced health system requires both curative and preventive services instead of just curative. Let us see the first role of doctors in hospitals, which is curative role. It includes diagnose and treat diseases, perform medical procedure and surgeries, provide emergency and inpatient care, and the focus is only individual patient care. If we cure, we will cure only the one person or the person who step in the hospital for the treatment. This is only curative role. And the goal of this curative role is that restore health after illness. What is the role of doctor in society, which includes preventive and promotive role? It has some subdomains. First one is health education. Conduct awareness program on hygiene, nutrition, and smoking cessation. Encourage healthy lifestyles and early health seeking behavior. Disease prevention, support and implement vaccination programs, participate in screening for chronic diseases like diabetes and hypertension, promote sanitation, safe water, and environmental health, community based care, serve in rural and underserved areas, work with community health workers and public health teams, provide primary health care at grassroots level. In the time of disaster and emergency response, doctors should offer medical services during floods, earthquakes, and epidemics, participate in relief camps and humanitarian missions, policy and advocacy role, advise governments and non government organizations on health policies, advocate for health equity, resource allocation, and underserved populations. Why serving society is important? This is an important message. Many diseases are preventable through lifestyle and environment control. Hospitals alone cannot reduce disease burden, and public trust in doctor helps promote behavioral changes. So it's important. The serving society improves the population health and not just individual care. So this is the role of doctor into the society with the prevention, promotion, and the curative role. Thank you very much.